So let's talk about exercise, which I just said was the best tool to improve the quality of your nighttime sleep. Exercise is going to build up a healthier microbiome. It's going to regulate your circadian rhythms. It improves energy production. It releases the good mood molecules, and it boosts your self-confidence and your self-esteem. There's no drug for that either. So exercise is clearly linked to lowering stress and anxiety. Lots of studies actually show us this. And here's another meta-analysis showing that exercise reduced anxiety symptoms compared to controls. And it can actually be used in conjunction with people that have stress-related disorders, and it can be used as an adjunct to whatever you're already doing for anxiety and depression. It'll just help you more. And I suspect many of you are here, if you're already on medications, that they're not working as well as you hoped. So here are so many tools that you can add on to boost that antidepressant effect. So a third of patients actually don't respond well to SSRIs for depression. And CBT is cognitive behavioral therapy. It's just not enough. And we know exercise is very impactful for mild to low depression, and it can actually rival the effect of SSRI medications. That's how powerful it is. This can be both aerobic and non-aerobic exercise. So you pick what works for you. In fact, I think it's great if you can get into aerobic activity to do a combination of both. And for some of us, maybe who have weakness in our legs, but still have good use of our arms, we can use resistance bands. We can really get into aerobic levels of exercise, just being creative and working with our physical therapist to figure out what's possible. And another study just showed a longer study looking at exercise 3 times a week for 9 weeks was really effective for depression. So I think the way exercise works for depression is when you exercise today, it does help you immediately. I've never had people exercise and they tell me it made their depression worse or it made their anxiety worse. Never, not one time. But it can actually, if you actually get into a routine of it, it actually is that antidepressant effect is further boosted. You'll get more out of exercise if you do it long term. And by long term here, it's 9 weeks. So think about where you could be in 9 weeks. And I think that it's important to find exercise that fits and is something that we're willing to do. So exercise is an important addition to whatever you're already doing to treat anxiety and depression. And exercise can actually have a preventive effect for anxiety and depression. So maybe you're here because you just want to know how to avoid mood issues. Exercise is your tool. And I really like weight training. I mean, it has so many benefits, especially as we get older. But when we do weight training, it actually mimics the symptoms of anxiety. Heart rate and blood pressure go up. And then when we rest in between sets, our body actually learns how to adapt to those symptoms. Isn't that interesting? So weight training can actually be really helpful for anxiety and depression. So however you choose to do that, whether it's free weights or resistance bands, it's all great. So think about incorporating more weight training into your routine. And as I said, find something you enjoy and then answer these questions like, are you a person that needs to exercise with others or by yourself? In the morning or in the afternoon? Do you need to be at the gym or at home or in a class? And what exercise are you going to do? I hope that you mix and match a couple of different exercises because it's good to challenge your body in different ways.